Hello, beautiful people. Carol Christensen here with my 2.5-year post-surgery update. It was recently brought to my attention that it had just been way too long since I had given an update. So here it is. Yay. So today is September 8th, 2013. And I had a craniotomy to remove a medium-sized acoustic neuroma on February 1st of 2011. So some time has passed. If you've been following me or you've seen my videos before, you know that I had a temporary facial paralysis. The tumor was on the left side, and for quite a while I had some problems with balance and pain, a lot of facial pain, a lot of swelling around the surgical site. I did 3 months of very intensive vestibular therapy, which I highly, highly recommend all acoustic neuroma patients do, or anyone that is having any issues with balance or inner ear problems. My surgeons didn't even tell me about this therapy in the beginning. I kind of had to do some pleading with them, and then finally they were like, well, I can send you to vestibular therapy, and that helped me so incredibly much. And a lot of the exercises that I learned in that therapy I still do today, just to kind of keep me on an even keel. You know, every now and then if I'm overtired or just working too much, not taking great care of myself, I can definitely get unbalanced. The balance issues come back. So I do the exercises. It's a sign for me to rest and recuperate and be in a quiet environment and nurture my body with organic, healing, whole foods. So I have this new kitten here. Isn't she cute? She's trying to be a part of the video right now, so you'll have to excuse her. Anyway, so yes, vestibular therapy was huge for me. I highly, highly, highly recommend it. Make sure you do it. Find somebody who's trained in it and do it. It will help you. So, 2.5 years later, what does my life look like? My life today is very full. It's very amazing. Very amazing. It's embarrassing to say. But it is. It's amazing. I feel that this whole experience has truly blessed my life. It's forced me to be a new person. I used to live a very stressful life. I worked a lot. I didn't really pay too close attention to my body. I let things really stress me out. And today, I don't do that. Nothing really stresses me out, just because once you walk through such a huge ordeal as we do, we realize life is precious. Our bodies are precious. And today, I'm going to do whatever I can to take care of this gift. So, a lot of questions that I'm still getting are like, is it difficult to adjust to the world with hearing only in one ear? Yeah, you bet. Absolutely. Why wouldn't it be? You know, it's going to be difficult. All of it's going to be difficult, but it's worth it. And, you know, I don't know that I'm really, I've ever really been the same. I can't hear out of this ear, as I said, and I can't tell where sounds are coming from, and a lot of times I have pressure in my head. That's me. Not everybody has that. But, you know, my body isn't the same that it was before surgery and before the tumor, but that's okay. You know, it's a new body, it's a new life. I feel like I get a second chance. If I'm tired, I rest. I wouldn't have done that before. I would have just pushed my body and pushed through, and, you know, today I rest. Today I take care of myself. Today I avoid loud situations and, you know, just things that would possibly put me at risk to having a headache or having the sound in my ear increase. I wouldn't have done that in the past. I didn't know how to care for myself. So really, for me, this has been a blessing. It really, truly has. I learned a lot about self-care and self-preservation, and I really, truly learned how strong I am. And I hope that for all of you, I hope that you can see the positive side of this, while also acknowledging that it sucks. You know, it really sucks to have to go through something like this. Sucks. And it's good to acknowledge that and to feel it and to let it go. You know, don't stay in it. Don't stay in the negativity. But in order to release it, you have to feel it and acknowledge that it's real for you, and move through it and get to the blessing, because it is a blessing. We get a second chance. We get to live, and life is so amazing and precious. It's such a blessing. So I'm still talking to a lot of you out there in YouTube world. If you have any questions for me or comments or anything, please inbox me privately. I will try and answer all of your emails. Try to be as prompt as I can. I know it can be super, super, super scary, but I promise you, life does go on. And in my case, life has been better. It's just, I couldn't have dreamed this up for myself. The way that I was forced to change and slow down and acknowledge what is real and what is important. I couldn't have done this on my own. I don't know. Maybe I could have. Maybe I would have had a life epiphany or whatever with something else, but I didn't. And this helped me to look at life in a different way. And I pray for that, and I hope for that for all of you. And that's it. Thanks for listening. Namaste.